So welcome to Advanced Care Planning, Making Life Choices. We're excited to have Katie Ballard here with us today. A reminder for folks who haven't been on a webinar before that this session is being recorded. So please leave your microphone muted. When you would like to participate, if you have a question or comment, feel free to unmute your microphone or use the chat feature. I will be keeping an eye on the chat feature throughout. So if you do have questions, feel free to post them there and we'll make sure we have a chance to go over them and answer them. So we do have a schedule posted on our website and at the clinic for what the webinars are that we can expect to see for the rest of June and July. We are starting to build our schedule for August. So if there's anything you would like to see, let me know. I'm happy to find a speaker and a way to bring another topic to our schedule. We have the next one that's coming up is a COVID-19 Q&A, Reopening Colorado with Dr. Hammond. So that's next Wednesday. We actually are switching to Wednesdays at 6 p.m. based on some feedback from our Patient Advisory Council and from you all. It sounds like maybe evenings are a better time. So we're going to try Wednesday evenings and see if we can get folks there. If you do miss a webinar, though, they are posted online. So if you're not able to make it live, feel free to check them out later on. Following COVID-19 Q&A, we do have a 4th of July survival guide, Eating Healthy Over the Holidays with myself, Stacy. If you want some tips on how to manage eating healthy at a holiday that's filled with chips and dips and all sorts of fun foods, finding ways to maybe modify those and still have a good time, but be able to meet your health goals and process. Take a look at the other ones that we have coming up in July, and we hope to see you there. These are all free, and they're about 30 minutes. To listen to this webinar again or to access recordings of these previous webinars, you can go to our website. Under the Forms and Resources, you'll see a Health Education tab that you can pull up there. I will be sending a survey after this session. I would love your feedback. Katie, I'm sure would too. Let us know what you thought, and it helps us improve our future sessions and continue to grow this webinar program that we're offering. Lastly, a reminder, we are here for you. Since the pandemic even started, we've been open for in-office visits. We also have televisit as an option too. You can schedule online with a chat feature or give us a call. We definitely have providers who are available to see you, and we are still accepting new patients. Our hours are 8 to 5 currently. So with that, I'm going to turn it over to Katie. We have Katie Ballard here. She is our family nurse practitioner at our clinic and sees lots of patients for visits from everything from acute to chronic care, but also she is our advanced care planning guru. So she's going to walk us through the forms and everything we need to know to make sure that the decisions and beliefs that are important to us are communicated to our family and those who are going to maybe have to make choices for us if we're unable to. So we're really excited to have her here today. So thank you, Katie, for being here. With that, I'll turn it over to Katie, and feel free to post any comments along the way if you do have questions.
Good morning, everyone. Stacy, thank you for the introduction. I think guru might be generous, but this is definitely something I feel passionately about and is a project near and dear to my heart. Before I came to Westminster Medical Clinic, I was a critical care nurse in the ICU. And so I've seen what it looks like when we don't have these advanced directives in place, and when people are very, very sick and potentially not able to make their own decisions, and family is struggling to navigate that. And so we'll go through this, but I think the biggest take-home message from today, if you get nothing else from this, I hope that you will feel that this is a tremendous gift that you can give your loved ones by having your advanced care planning figured out while you're feeling well, while you can make decisions and express what's important to you. Because really what we're trying to do here is make sure that we know what's important to you so that we can honor your wishes and honor your dignity. That's what we're going for here. So, and if we have that figured out ahead of time, it is a tremendous relief to your loved ones when we get towards the end of life and making hard decisions. So, Stacy, if you want to go on ahead with the next slide. So the objectives that I hope to cover today for you all, who should have advance directives, when should we talk about advance directives, what it potentially looks like if you don't have advance directives, can you change your mind if you've already put things down in writing, oh, I've got a little box hovering over here. How does advanced care planning affect your medical care here at the clinic or with other providers? And then how are advanced directives different from trusts or wills for property? So when we talk about medical advance directives, this is in regards to, these are the legal documents that allow you to plan and make your own end-of-life wishes known in the event that you wouldn't be able to make decisions for yourself. As long as you are able to communicate your wishes, if you are of sound mind, we will always go to you first. But these documents help, again, help us and your loved ones navigate if you're not able to make those decisions for yourself. In Colorado, we have 3 types of advance directives. So the first one is the medical durable power of attorney. And I've got some examples later on that I'll show you. But the medical durable power of attorney is the first one that we want to have in place. And this is you designating in writing that proxy, that person that's going to make decisions for you if you weren't able to. And you can put multiple people, you can put one, but it's a good idea to let that person know that you have listed them as your power of attorney. And this is just for medical decision making. Then the next one is the living will. And there's a couple different types. Down at the bottom of my list, you'll see the 5 wishes. This is a version of the living will, and it's my favorite. It's my go-to. Then there's also the third type for Colorado is the CPR directive, and that's what the most form goes into. And so the CPR directive allows you to potentially refuse in advance if you did not want CPR. So chest compressions, resuscitation, potentially defibrillation on your heart, or intubation for a breathing tube and being put on to the ventilator. And I think a lot of times we all know that these are important things to talk about and have in place, but we kind of think, oh, maybe next time I see my family, or next time I'll get to it next month. And right now, I think the COVID-19 pandemic is unfortunately a strong example of how quickly things can change in our world, and how our loved ones who or individuals that were otherwise healthy and well can suddenly become sick very quickly. So if we remember back to one of those initial questions I posed, who should have advanced directives? It's anyone over the age of 18. I feel strongly that everyone, every adult should have some sort of advanced directive. So whether you are 18 years old or 102 years old, or anywhere in between, I think it is important that we all have these advanced directives in place. Another important thing to know about the state of Colorado is we are considered a interested party state. And so that means that the decision making does not automatically go to next of kin. So if you don't have that medical durable power of attorney designated, then anyone can claim to be interested or be able to speak up, saying that they know what you would want. So, and this is what I saw in the ICU sometimes, where perhaps estranged family members or a bizarre neighbor down the street, who knows how people find out, but it seems like people can crawl out of the woodwork and suddenly be speaking up, trying to say what they would want you to have, and they would have just as much say as your spouse or your children that know you well. And then it would have to be brought to an ethics committee, and you would have to have two separate physicians agree on who they would designate as your proxy. And so that can take quite some time to sort that out. So if we have things in writing, then it makes things really simple. And so that's why I keep saying this is a wonderful gift that you can do for your loved ones. I had a thought, I'll come back to it. Stacey, let's go to the next slide here. Okay, so these are some myths or some things that I think we commonly hear. I'm healthy, I don't need a will. And again, this is with the COVID-19, or unfortunately car accidents happen. You know, there's just a lot of unexpected things that can happen. And so if we have these in place, then we're better covered. Another common phrase that I hear with this discussion is, my family knows what I want. And unless you have sat down with them, gone through the paperwork, and really had these discussions, your family doesn't know, okay? And so it's really important to make this very cut and dry, and tell them exactly what you want and don't want, okay? And then some people, I think, just with our culture, I think sometimes we're fearful of death and talking about it, and so we kind of skirt around it. And so I'm happy to help guide you through these discussions and thinking of different scenarios. Jan, our RN here, she is just fantastic for so many reasons. I can't sing Jan's praises enough, but Jan is also really great. All of our providers are trained in going through this in these difficult conversations. So, and I think a lot of times we think, well, from the provider standpoint, we think, oh, if this was something that we needed to, that was on your mind as the patient, you would bring it up. And I think patients think the vice versa. Well, if it was important to the provider, or if we felt strongly that you needed these documents, we would bring it up. So I think some of you have been getting phone calls from me because I do want to bring it up. I do want to have these conversations. So, oh, and I realized the other thing I was going to mention. The nice thing in Colorado is these documents don't necessarily require a notary. You can if you want, but you just need witnesses to sign. Some of the documents do require your healthcare provider signature, and so we can go through that as I show you the examples. So why don't we move along? Okay, so this is that first one that I talked about. This is if you do nothing else, please get in writing who you want to make your decisions for you if you're not able. So this is that power of attorney. And so you can see that you put your name, and then you put your proxy information there. You can list alternates if you'd like down below there. And then if there's special instructions, you can put that in there too. I'll show you here in a couple slides the 5 wishes form, and we have all of these forms here in our office, and we can walk you through it. But the 5 wishes includes this portion as well, so that's my go-to, because I think it's it really covers a lot of ground. Why don't we do the next one? And then this one is called that Colorado Most form. So this is that CPR directive. And if you have received a copy from us in the office, we put it on bright green paper. So that's why I put a green border around this. So maybe we'd have that visual association. So this essentially goes into kind of 3 levels of care. So the first question that you have to ask is if you were not breathing, or if your heart were to stop, do you want us to do CPR? And that's chest compressions, that's being intubated, that's going to the hospital and being in the ICU. And so you can say yes for that. And then so that's section A. And then in section B, even though if you said you want full CPR, you can opt for either full treatment or selective treatment. And so the selective treatment is kind of that's kind of the gray area. What you cannot do though would be to mark that you want CPR and you also only want comfort focused treatment. Those two just don't line up. So if you were thinking that you're at a point where you would just want to be kept comfortable, have your pain managed, your breathing comfortable, things like that, then that would go along with saying that you would not want CPR, that you'd be okay, that your time had come, and we would keep you comfortable, but we wouldn't do any life-sustaining measures or prolonging measures. And then the C option gets into artificial nutrition. So that would be a feeding tube, whether that's a temporary one, through your nose, or potentially a more permanent one for a surgery that would be the feeding tube placed into your stomach. And so again, you kind of have a few options there, and you can indicate if you'd be okay with it for just a little bit of time, as long as we think that you are going to make a recovery, or if you'd be okay with having it forever and ever, or if it's something you don't want at all. Okay. And then so this is the one that we do need to sign and go over with you. And so this would definitely be something that we can do for you in the clinic. So Stacy, why don't we move to the 5 wishes? So as I mentioned, this is the one that I really like. I think it does a very nice job. It is honored in 42 states across the nation. And so the very first wish, wish number 1, is your medical durable power of attorney. If you can't make decisions, who is going to do that for you? And then the next one goes along with the medical treatment, similar to that most form that we just went over, whether you would want CPR or artificial nutrition, things like that. Then the last couple wishes, kind of 3, 4, and 5, shift focus a bit towards if you, if we are towards the end of life, getting more specific into your wishes and what is going to make you comfortable, what sort of things will make you feel like you were treated with dignity. And there's a nice one with the 5th wish, where you can actually work on some messages to your loved ones if there's important things that you want to convey to them. I'll share kind of a funny story, because this does get a little heavy. And so about a year ago, we did an exercise here in the clinic where many of the staff members worked through this. And if any of you remember Sandy at the front desk, she had done this, and she had started thinking about what she would like for her funeral services, and she's very into music, and so she had written down all of her favorite songs. And then when she started listening or heard them on the radio, they kind of made her a little bit sad, because now she was associating them with her 5 wishes instead of her favorite songs. So that's okay. We can work through that. But again, the 5 wishes, I think, is a really great document that we can have here in Colorado. And there's a few things to go over as far as who can witness, and things like that. So this would be a good one to come into the clinic, and we can walk you through it. Okay, so then once we've kind of gone through kind of the basic things for the advanced directives, then here at Westminster Medical Clinic, we think it's important that we take this conversation more in depth. We want to know what's important to you, and I think it's important to have these conversations when you're feeling well, so that we can anticipate when you might get sick in the future, what's going to be the most important to you. And so when we go through these conversations, we can talk about if there's anything you're wondering about your health conditions, or anything that you're fearful of or worry about. And really, we want to know what's most important to you, and then that helps us aim your care. So sometimes that could be things that are important to people. Perhaps you want to go visit a certain national park, or you want to be able to attend your granddaughter's wedding, or be able to see a certain sports event. Whatever it is, it doesn't have to necessarily be getting your diabetes numbers in really good control. Sure, that's important, but we want to think bigger picture. What's important to you as the individual, so that we can know how we can shape your care here. And then again, I can't stress it enough, you have to share this information with your loved ones. Once you've kind of thought about what's important, other people need to know about that, okay? So we can go to the next, Stacy. Perfect. Yeah, again, we are here to help you with these, whether it's going through the forms, finalizing things, or if you want some help talking through some of this stuff with family, we're really happy to help navigate that too. So I I feel very passionately about this, and thank you for listening to me. I know that was a lot of stuff, so I'll open it up to questions here, but please come see me. I love talking about this, and I promise we can find some humor, and we can have a good conversation together. So let me know what questions do you all have.
Hi, Katie. It's David Roberts. Can you hear me okay?
I sure can.
Forgive me if you covered this and I missed it, but I have a question specific to DNRs. Is it true here in the state of Colorado that if you have a DNR in place, if you're admitted to a hospital, that requires a separate DNR for in-hospital care? Is that true?
So they're just going to want a copy of it. So that most form, that green one, I
Yes.
recommend that people keep that on the refrigerator, especially if you have decided that you are a DNR. If something were to happen and you need to get, if 911 is called, then the paramedics know to look at the refrigerator, looking for that Colorado Most form specifically, so that they don't accidentally try to do chest compressions on someone that has said that they're a DNR, a do not resuscitate.
Okay, and one more question, and again, this relates back to the durable medical power of attorney. Is that document in this state required to be notarized, or it does not have to be notarized?
It does not have to be notarized, but we do strongly recommend to protect the legality of the document. Whoever you put as your proxy, your decision maker, should not be the witness.
Okay.
And you usually need 2 witnesses. So whoever you put for your decision maker needs to be somebody else. So a neighbor, a friend, whoever. And it also cannot be, for that part, for the decision making, that can't be us at the clinic either.
Sure.
Can't be a healthcare, one of your healthcare providers.
Super. Thanks for the help, Katie.
Sure. Good questions. Oh, and I realized I posed this question earlier and I did not cover it. Can you change your mind? Absolutely. Absolutely, you can change your mind. And with that said, if you have documents in place, it's a good idea to pull them out and look them over and make sure that it's still accurate.
Well, I don't see any other questions. Do you, Katie?
I don't.
Okay. Well, if you all have any other questions, feel free to email them to me. I'll be sending out that survey. So just reply to that and I will get them over to Katie, and certainly feel free to schedule an appointment with her or Jan to discuss more. Really appreciate everyone being on the webinar today. And Katie, thank you so much for your time and your expertise. It's an important topic, and it's something that I think is important for all of us to do. So with that, we hope you all have a good rest of your day. And Katie, I don't know if you have any other last comments or thoughts before we wrap up.
No, just thank you all so much for listening. This is very, very important and close to my heart. So I appreciate your time this morning and letting me rapid fire all of this information at you. I'm sure it's clear as mud. So come see me and I'll see if we can sort things out for you.
Wonderful. Thank you so much. Bye, everybody. Have a good day.
Bye. Thank you, Katie. That was really informative.
Good. I'm glad it was helpful. Have a good day, everyone.